rest of the week. One thing that I'm sure, Tony, you've seen as well is the employers who are
This conference is being recorded. Only the main conference is recorded.
That are utilizing exempt employees, and they want to, and those are management usually or something like that, and they want to keep them employed, and they want them to work a certain amount of the part of the week. For example, a person who is in a management role and might have worked 50 hours a week, employers are recognizing that those folks are now working something like 10 or 15 hours a week, but you still want to keep them around. There is nothing wrong with taking an exempt employee and making them temporarily a non-exempt employee. And how do you do that? You simply, you presumably, because this is usually a cost-saving measure, you're changing that exempt salaried employee into an hourly employee for a temporary period of time. You can do that prospectively outside of a work week. In other words, don't do it on a Wednesday if their work week is, you know, Monday through Friday. Don't do it in the middle of the week because arguably they're entitled to that salary for that full week. But when you start a new work week, you can change that person to a non-exempt employee. And of course, then they would have reduced hours and can collect unemployment for probably to make up for the reduced hour piece. And then finally, layoffs are certainly something that a lot of employers are looking at. We should be careful there in the context of whether or not, depending on what state you're in, most of you are in Wisconsin, there are WARN obligations, meaning those are those advance notice obligations under federal law that applies to employers with 100 employees. In Wisconsin, we have a mini WARN Act. We have published articles on that. If anybody's interested in looking at that, that applies to 50 employers with 50 or more employees at a work site. Generally speaking, if a layoff of workers is supposed to be a short-term duration, you're really thinking about a furlough, then you're not triggering WARN, generally speaking. However, if you are talking about a layoff, and a layoff, mind you, is in fact a termination. It just describes the reason for the termination, but the person is no longer your employee. And if the number of employees who are laid off triggers those numbers for WARN obligations, then you have to think about that. Now, there are exceptions to the WARN Act for the term used as unforeseeable business circumstances. I think it would be anyone would be hard-pressed to challenge this situation as an unforeseeable business circumstance. So there are certain exceptions to the WARN, but you should be aware of that. You should look into it if you're talking about laying off numbers of employees, which would trigger that. And then if you happen to be in another state, or operations in another state, then you should look to see if there are any WARN obligations there. Okay. Tony and I are going to talk about the Families First Coronavirus Response Act. Of course, that is the law that provides paid sick leave under certain circumstances and also expanded FNLA, even to those employers, as you might imagine, who have never had FNLA obligations before, those ones that are between 1 and 50 employees. But first off, I think it's probably useful to talk about what employers does the Fair Credit Reporting, or I'm sorry, I keep saying that, Families First Coronavirus Response Act apply to. It applies again to businesses with fewer than 500 employees within the United States. You do not include, to the extent anybody has employees that are working overseas, you don't include those employees. You do include full-time and part-time employees, employees who are on leave but still on your payroll, employees who are jointly employed by you and another employer. That's a big one that I'm seeing a lot. And I don't know about you, Tony, but I'm seeing where employers have multiple locations or businesses that are some way, they're subsidiaries, they're affiliated in some way. And generally speaking, for purposes of the Families First Act, they are jointly employed, and therefore you have to count all of them at all of the different quote-unquote employers, even if those employers are independently incorporated, if there are certain criteria are satisfied. Generally speaking, we're talking about common ownership between the different companies, and a lot of the criteria have to do are really focused on whether or not the HR function is centralized. In other words, do you have an employee handbook that is sent to all employees at all the different companies? Do you make hiring and firing and disciplinary decisions and things of that nature at the centralized? Do you handle benefits in a centralized fashion for lots of the different for more than one quote unquote W-2 employer? Then it's very likely you're going to have to combine all of those to figure out if you're over 500 or things like that. And then lastly, temporary employees, at least for the purposes of this act, are included in your number, so be careful there. What it does not include is independent contractors. Okay. Now, I just wanted to talk, before handing it over to Tony, I just want to talk briefly about the small business exemption. This is big and her recent news, because this guidance that we're just about to talk about was only issued by the Department of Labor late Saturday night. So this is really hot off the press here. The exemption applies to businesses with less than 50 employees under certain circumstances, as we'll talk about. It only, and I'll get to this a little bit more detail, it only exempts you from providing child care related paid sick leave or school related paid sick leave or expanded FMLA. And it applies if providing that child care or school related leave would jeopardize the viability of a business as a going concern. So that last bullet point, pay attention here, because people are thinking, a lot of small employers are thinking, if I'm under 50 and I can provide and I can meet the criteria, then the entire Families First Act does not apply to me. And that is not the case. The Department of Labor guidance that was released on Saturday makes it very clear that it only exempts you from providing paid sick leave due to school or place of care closures or child care provider unavailability. And it also only exempts you on the FMLA side for leave due to school or place of care closures or child care provider unavailability. So for example, if you have an employee who is claiming, even if you're one of those employers under 50 employees, even if you have an employee, for example, who has COVID-19 or COVID-19 symptoms, that's something that triggers coverage, you would in fact have to provide paid leave or paid FMLA, expanded FMLA, despite your size, your small size. So that's really, really critical. Now, as to that school leave and child care leave exemption, there are 3 ways to do it. And Tony and I were talking about this, that people are thinking that it's an easy out, but you have to be careful to know that you can actually meet some of these criteria. One is the provision of paid sick leave or expanded FMLA would result in the small business's expenses and financial obligations exceeding available business revenues and cause the small business to cease operating at a minimal capacity. You can kind of foresee something like that in a scenario where you're a small business and you have an office manager. I think that was an example we talked about earlier, that it would really be problematic if that person was gone, and or the expense of replacing that person for a period of time would cause a problem. Or you have a situation where lots of employees are claiming it simultaneously, and to pay that leave, whether it be sick leave or family medical leave or both, would cause a serious financial problem that would be problematic. The second one is the absence of an employee or employees, that's that office manager I mentioned. Requesting paid sick leave or expanded FMLA leave would entail a substantial risk to the financial health or operational capabilities of the small business because of their specialized skills, knowledge of the business, or responsibilities. Or, so remember it's an or, so you only have to hit one of these 3 that we're talking about, not all 3. And the third one is there are not sufficient workers who are able, willing, and qualified, and who will be available at the time and place needed to perform the labor or services provided by the employee or employees requesting paid sick leave, or expanded FMLA, and these labor or services are needed for the small business to operate at a minimal capacity. So those, there we have it. As of Saturday, we at least have something to work with. Now remember, again, can't emphasize it enough, it only exempts you from the child care portion or the child care or school related absences, but it does not relieve you of the other responsibilities. The other thing I'd just like to mention before I get off that is there's a lot of questions. Well, how do I file for this exemption? What do I do? Well, we don't know because there is no explanation other than a note in the guidance that says that please do not submit paperwork as to the exemption to the Department of Labor. And presumably, while they don't explain why they said that, and presumably it's because they don't want a filing from every single employer with under 50 employees being, inundated in that way. So what we're recommending is that employers simply document that by that language there at the top, on authorized officer of the business we would just suggest that you write it down and keep it for your own records. So in the event of an audit or a challenge that you're good there. Okay, Tony.
Yeah, thanks, Laurie. And yep, I am still here, and folks, glad to be here, and glad to be talking with all of you today. And extra special kudos to Laurie and other members of our team for pulling together a lot of the information that we've got here today, and that we hope is helpful. I'll give a little bit of a disclaimer in that my current home office is also a current school. So if you hear some kiddos in the background, I would not follow their legal advice. Then that it's probably not going to be as helpful as you'd like. So we're going to get into some additional issues, but there were just a couple of things from what Laurie was talking about that I want to emphasize that we've been running into from a practical perspective, an operations perspective. And the first one is how Laurie talked about if you've got people teleworking, particularly non-exempt people teleworking, how critical it is to insist on accurate timekeeping policies in these times. It's a paperwork hassle. There's no doubt about it. And odds are most, if not all of you will receive some sort of flack for insisting on extra detailed timekeeping. But it really is critical, because out of this situation, it's fairly certain that once the dust settles and we get back to normal, that's when the claims against employers like you are going to start arising. And one potential avenue is that people teleworked during certain times and weren't adequately compensated for it. So that's one thing you really need to emphasize with your staffs and with your management, is that you must insist on that. On top of that is that these are hard financial times, and we want to make sure that we are only incurring obligations for what we are expecting. The second point, quick, before moving on, is Laurie hit it directly on the head about salaried employees who might not be required to work at full capacity. There's often a misconception that because somebody qualifies as exempt that they have to be paid on a salary basis, and that's not the case. The case is that the exemption gives you the opportunity to pay a salary as opposed to hourly. And so there's nothing stopping, like Laurie said, a temporary switch over to converting employees on a temporary basis to hourly, such that you can more accurately control their hours and so on. So those are just two things I wanted to emphasize before moving on to the next question of the day, which is the next slide.
Tony,
go ahead, Laurie.
Tony, one question that's been asked really quickly is a lot of, by the way, I'm getting a lot of questions in the chat function, and that's fine. I'm reading them and noticing that some of them are going to be covered in the slide. To the extent that they're not, I'll try to insert them if I can. One question, Tony, is the teleworking is decided by the employer or the employee. What happens if an employee is demanding that she telework? What do you think about that? Who gets to decide if it's telework or not, if telework is possible or not?
Well, Laurie, I think that's a great question, and that's one thing that we have been running into quite a bit, and it really ties to the whole issue of, you know, somebody demanding teleworking, and let's operate on the premises that the person is demanding the opportunity to telework because they have a generalized fear or concern about contracting coronavirus, right? That's where we're getting the questions all the time. My stance on that, and if you disagree, Laurie, tell me, is at the end of the day, it is the employer's right to determine whether to allow teleworking. And there's nothing in the law that says you have to, unless, you know, obviously if somebody's sick with coronavirus, that trumps everything. But no, my position is that simply somebody wanting to telework doesn't give them the right. And if from an employment and operations perspective, it's not feasible, or you don't want to allow it, you want somebody to be there, I think it's well within the employer's right to say so. And if that employee chooses that they don't want to follow that directive for whatever reason other than actually being sick or having the other reasons to be entitled to the leave, that is the employee choosing not to fulfill the duties that are requested of the employer.
Yeah, I agree, Tony. I think that, I mean, it's such a case-by-case situation, of course. And then, of course, employers are faced with safer at home or, you know, shelter in place, wherever you might be, orders from either the state or the municipality or both, and that certainly encourage the use of telework. And I think that I think the DOL would probably agree, they would encourage it, but they don't mandate it. And, you know, of course, it's so case by case, because in certain circumstances, the employer is going, you can't do all of the things I want you to do from home, because whatever the nature of your job is, doesn't allow for that. And I think, Tony, you're right, that ultimate decision remains with the employer.
Exactly.
And then the question is, of course, what happens if they just don't want to, you know, then it becomes a situation where they just don't want to come into work and they haven't triggered a reason for leave.
Right, exactly.
And then a lot of employers are looking at that as a quit, right?
That's exactly right. They're looking at that as a quit because...
Or unpaid leave, one or the other.
Or go out on unpaid leave, but we're not going to pay you anything. But where the employees really need to understand in those circumstances is that if an employee refuses a reasonable job directive, that is probably considered a quit. And then if the business decides, well, if you're not going to play ball as we're outlining, then you can leave. That employee's going to probably have some problems collecting unemployment because they quit. And normal unemployment rules would still apply.
Yeah, and unemployment is such a state-by-state thing. You'd be interested to hear that, like, there's a couple of pretty employee-friendly states, I know Oregon being one of them, where they've actually included that something in their unemployment law that says that if you have just decided you have refused available work because of concerns, that you are still entitled to unemployment. That kind of, you know, flies in the face of what we've always known about unemployment, and that being that a person is, you know, a person can't refuse available work. If you have available work and you simply refuse to do it, that's a quit, and therefore makes you ineligible. But that's not true in every state. So to the extent that anybody's in another state, I would check at the state level.
Yep, and that's a great clarifier, Laurie. Sometimes I forget to take off my Wisconsin glasses, but hey, it is what it is. So, but this is all, I think, a really good segue into the next slide that we've got about quarantine and isolation. And the reason why it's a good segue is because we've been getting a lot of inquiries, and there's a lot of published material out there about this, about whether Governor Evers' order in Wisconsin, the Safer at Home order and other similar state orders, whether that qualifies as a quarantine or isolation order under the FFCRA. And several folks have taken the position is that, well, no, I have been ordered to stay at home, therefore I am quarantined or isolated, and therefore I'm automatically able to request and receive the paid sick leave under the Emergency Paid Sick Leave Act. And that is that has not been our interpretation of the law, and our interpretation has been supported by DOL guidance that's been issued. If you look at the CDC's and the Department of Health and Human Services definitions of quarantine and isolation, both of them specifically talk about somebody either being sick themselves and therefore needing to isolate themselves from others, or somebody who has affirmatively been exposed to the illness and therefore needs to quarantine themselves away from others to avoid spreading it. So based on that, our interpretation has always been that Governor Evers's or any other state's safer at home or stay at home orders is not a quarantine or isolation order. That was affirmed in the recent DOL guidance from late last week. I think it's what, Laurie, question number 24, where it says right in that guidance that no, a governmental order to just simply stay at home or your business is closed so you don't have work to do is not an order that would automatically qualify somebody for the 2 weeks of paid sick leave. So so that's important to remember. If an employee comes to you and says, well, no, my position has been furloughed because we don't have the business, and plus while furloughed, I need to stay at home, you need to pay me for 2 weeks. Obviously you'll want to consult with your specific legal counsel before acting, but our general opinion on that is that no, that position doesn't hold up, and based on the DOL guidance, I really struggle to see how that could be interpreted any other way.
Tony, I agree, and also, that goes against what we were or goes along with what we were just talking about, is the person who doesn't want to come in and is holding up that safer at home order. We do have one question that applies to this, and that is, what documentation can the employer require in connection with a quarantine or isolation? Let's say they think it's more than the safer at home. It's something specifically, that they are specifically isolated or quarantined or under that order. What do they need?
Well, my view of the law is they do need something from the doctor that says that. There are three categories, and interestingly to those listening, Laurie and I were talking about this very issue with a partner of ours earlier this morning, is that there's the three categories of person. The first is you've been diagnosed with coronavirus. Well, you probably don't have a firm diagnosis of being infected with coronavirus unless a doctor has told you so. And in today's day and age, where most healthcare providers have online charting and online records where you can go into My Chart and get that would be one. The second is also doctors note, though, that you're ordered into quarantine like you were at work with somebody who's infected, therefore we're telling you to do that. Now, you get a doctor's note on that if you had a letter from your employer that said, well, turns out John Smith has coronavirus and your desk is next to him. As an employer, I'd probably rely on that too. The third category, which is a little trickier, is where somebody has begun to exhibit symptoms of coronavirus and they're seeking treatment. The issue that we ran into this morning was that we had an employee who had some symptoms. The doctor apparently said, well, you might have coronavirus, but I'm not going to test you at this point because I don't think you're in grave danger. Situation like that.
Yep, I'm seeing that a lot. Yeah, where a person can't get the test and their doctor is saying, I don't even want to see you unless you have difficulty breathing or something, because I don't want to be overrun. And, we'll just tell you. They're just verbally telling the employee to take steps.
To keep me posted, exactly, and to stay at home. So at that point, as an employer, you're going to have a little bit of faith that your employee is not completely scamming you, right? But I think you can also ask for, hey, if it's that, yes, the healthcare system is incredibly taxed right now. They are incredibly busy. But I think, if an employer in that if an employee forwarded you the email where they email their doctor hotline or something like that, that says, hey, as we discussed, this is what you told me, can you please confirm? at that point, I think you probably have enough where you should grant the leave. And one of the practical reasons as to why, which we talked about this morning, was, yeah, two weeks of the pay is really expensive, but after this all settles, defending some sort of claim that you wrongfully denied the pay is probably going to be way more expensive than just paying them in the first place. So,
and I think you'd be hard pressed to do it. I mean, under the qualifying, the numbered qualifying reasons for leave, if you look at your posters that I hope all of you have, number 3 is experiencing COVID-19 symptoms and is seeking a medical diagnosis.
Right.
It doesn't contemplate that the person has one in hand yet. And I think maybe that's, they're contemplating the fact that maybe not everybody has, there's not enough tests available. Maybe it's impossible to get that diagnosis. So I think it's dangerous to deny it in that circumstance. Maybe you can get at least a note from the doc that says, something. Now, what happens if they don't see a doctor? They're only talking to them on the phone or something like that. Then it just becomes that gray area, like you mentioned.
Yeah, exactly. And, when you look at your healthcare records too, if you call the doctor, that doctor or other healthcare provider to fulfill its charting and record keeping duties is probably at least dictating a quick note to say that you called or that the nurse got the message. So have faith at first, but I see nothing wrong with insisting on while the person is taking the 2 weeks to work to get something just for our file to show that you were seeking treatment with regard to it.
Sure. And then pay for part-time employees. If you have folks who are part-time, they're counted in the mix for the 500. But what do they get paid? A part-time employee is entitled to leave for his or her average number of work hours in a 2-week period. So you use the number of hours the employee is normally scheduled to work, or if the employee's schedule varies, use a 6-month average to calculate the average daily hours. That is provided in the guidance, and I think that's about right. Let's see if I can get this to go. And then the expanded FMLA, and this is really, we recognize that this is a struggle for many of you people who have never had to deal with FMLA, but an employee who cannot work because the employee is caring for a child whose school or place of care is closed, or child care provider is unavailable, may be entitled to up to 12 weeks of paid leave. This includes the initial 2 weeks of paid leave provided under the paid sick leave portion of the FFCRA, and an additional 10 weeks under the expanded FMLA at 2/3 of the employee's rate of pay. Now remember, we talked earlier, you might be able to get an exemption if you fit that criteria, but only for that child care or school related leave.
All right, and Laurie, if I may hop in quick, one thing on that end is some of the questions we got involved whether this new FMLA, the extended FMLA, which applies to basically anybody any employer under 500, whether that changes any of the, what I would call regular FMLA obligations. And the answer to that is no. You still have regular FMLA. Regular FMLA only applies to the employers that are covered and the employees that are covered. So, this, for you small employers out there who wouldn't otherwise qualify for regular or qualify for regular FNLA, this does not create that additional obligation. However, in looking at the guidance for you folks that this would apply to, as well as the regular FMLA, this does not create two different 12-week leave buckets.
That's right. Yeah.
And that's important to remember. And I thought that guidance was really helpful, because if somebody takes the expanded family and medical leave now, and then 6 months from now gets sick and needs FMLA, their leave bank would be exhausted. And it doesn't pick up, assuming other rollover things aren't met, however you calculate FMLA.
That's right. That's right. I've actually had that situation where I've had a couple of employers call and say, well, I'm between 50 employees and 500. I've always had FNLA obligations. And somebody has already taken 12 weeks of maternity leave or under FMLA, or has already taken, 6 weeks for a broken, something, a surgery or something like that, that they don't get an additional 12 weeks on top. The 12 weeks is the total. The expanded FMLA is only expanded in terms of expanding what employers it applies to and the reasons you can take it, but it doesn't expand the bank, if that makes sense.
Right, exactly. And another thing to remember, folks, too, is that when the emergency extended medical leave was first out, there were versions of the bill that applied the extended FMLA to situations including the individual's sickness with COVID-19, as well as the parental leave. But that was not the case in the final law. So to the extent somebody gets COVID-19 and after 2 weeks isn't better, which for all we know very well could be the case, they would not have the right to extended payment under the FMLA. That only applies to you're stuck at home with the kids category. So
okay. I want to be cognizant of time here. An employee may telework when an employer permits or allows an employee to perform work. I think that goes to what you were talking about before, Tony, from work from a home or a location other than the normal workplace. Normal wages must be paid, but telework is work. It's compensable time just as if they were at work, and so must be compensated in those ways. So, and now we get into a lot of the questions, Tony, and I'm sure you've seen them. What happens, because April 1st is coming up, a lot of employers have made calls, that have affected people before April 1st, and what happens? If they're still furloughed, for example, and therefore, quote, on the payroll, do they have rights as soon as April 1st rolls around? So if an employer has furloughed workers before April 1st, are those employees eligible to get paid sick leave and or expanded FMLA? And the answer that we've always given, and we're heartened to see that we were correct according to the DOL, is that no, because, it's like, one of our partners actually said it really right, is that if, expanded FMLA or paid sick leave is used to excuse you from hours you're supposed to work. If you aren't scheduled to work that anymore because you have been furloughed, you can't use the leave to cover it. So if prior to the effective date, which is April 1st, remember a lot of people said April 2nd, but then the Department of Labor, the ultimate April Fool's joke, everybody said April 2nd because that was 15 days from the day that President Trump signed it, and that's generally the case, but they made it April 1. If prior to April 1, the employer has furloughed workers because it doesn't have enough work or because it's closed by order of a stay at home work, and they're not exempt as an essential business, those employees are not eligible for paid sick leave or expanded FMLA. Of course, they can probably still get unemployment insurance benefits, almost certainly, in fact, under most states' laws.
And one thing, if I could hop in quick on this one, Laurie, too, is this is exactly right. Where you want to be a little bit cognizant of what you're doing, though, is you don't want to create some sort of disparate treatment or impact scenario with regard to employees taking the extended leave. For example, you've got 50% of your workforce that needs to be furloughed, and it just so happens that every employee who's requested the extended FMLA is on the furlough list. That might be absolutely fine, but it might smell bad. So you got to make the business decisions that you need to make, but at least be aware that if somebody comes to you and says, well, if we've got to furlough people, we should just furlough everybody who's requested this leave. Well, that might not come out well in the wash in the long run.
Tony, I don't know if you've seen this before, but in terms of FMLA, when we talked a minute ago about, you get one 12-week bank. Now, under the federal FMLA, it's 12 weeks total in a 12-month period, but employers are allowed to do that on a calendar or a rolling method. Right. Presumably, and you correct me if I'm wrong, I haven't seen anything that changes that. So in other words, if you are using a rolling method and not a calendar method to determine what 12 months we're looking at, that would still be the case under the expanded FMLA. Have you seen anything different?
I have not.
That's one of the questions, yeah. Okay.
I have not, and it might have been one of my extended leave dreams I've been having lately, but I swear I saw something that actually said, kind of reaffirmed that under the law, the employers have the leeway to decide how to count.
Okay, so then we have the next scenario, if I can get it to work. Whoops, sorry. If an employer closes a worksite on or after April 1st, so the FFCRA has taken effect, but before the employee goes on leave, but maybe that the person has indicated they want to do it, is the employee eligible to get paid sick leave and or expanded FMLA? No, in this scenario, for the same reason, because the person isn't scheduled to work anymore because they've been furloughed. So you can make that furlough decision. We've had a lot of questions internally about when do you have an FMLA interference claim, and that's you are interfering with a person's right to exercise their rights under the law. And usually you see those kinds of claims when, say, under regular FMLA. Let's say you have an employee who's who hasn't worked for you long enough to be eligible, because usually you have to have been there under regular FMLA, you have to have worked for the employer for a year and had enough hours in during that time. And now it's 30 days only, but let's say that person is pregnant and you terminate right before they'd be able to qualify for that paid leave. That usually results in what we call an interference claim. I think in this scenario, if you as an employer can articulate and establish with, pretty good evidence that this is a financial decision that came out of the blue, and whether or not that person was going to take that leave, the same thing would have happened. Whether or not the person, you're not, in other words, furloughing that person in order to avoid the leave. You are simply doing it because whether or not they were going to take the leave or not, you were going to get rid of that person because there's not enough work to do. Then I don't think you have an interference claim. Do you agree, Tony?
I do agree. And in that vein, as you all love to hear from your friendly labor and employment lawyers, document. Make sure that, if you're making the business choice, there's going to be a lot more leeway under these times. Businesses are getting hit hard. Sure. And anybody who tries to deny that is drinking a different kind of Kool-Aid. But still, make the educated decision, talk to the people that you need to talk to in your organization, and then be sure to have your reasons down pat. But otherwise, you got to make the business decisions that you need to make in these times. And,
sure.
But you have to do so while knowing that not everybody's going to be happy with the decisions that are made.
Sure. And whether or not, an employee may be eligible for unemployment insurance benefits, obviously you don't make that call, the state makes that call, whatever state you're operating in. And, in those scenarios, the person might not be eligible, for paid sick leave or expanded FMLA, but in most circumstances, they're going to get unemployment during that time. Yeah. Okay, so what happens if the person's already on leave? What happens if you've given the person leave or expanded FMLA, and maybe you don't make the decision as of April 1, but maybe you make it a week or two from now, and the person has already decided to take the leave, and you've granted that. What happens to that person? Well, the employer must pay for any paid sick leave or expanded FMLA that the employee used, of course, because that they were on leave from regularly scheduled hours before you made the call. However, as of the date the employer closes a work site or lays off the person or whatever it might be, the employee is no longer entitled to paid sick leave or expanded FMLA. That is really consistent with longstanding views of FMLA leave, that a person is entitled to callback and things like that, and entitled to be put back into the role that they had before, but they're not insulated from decisions that would have happened whether or not they were on leave. So if in fact there is a layoff during that time, then you they aren't insulated from that, and it still goes forward. And then, of course, once they stop getting paid via the paid sick leave or the paid portion of the FNLA, then they might be entitled to unemployment there. Okay. So same kind of concepts happen with a reduction in hours. If an employer reduces an employee's scheduled work hours from what they're regularly scheduled to do, the employee may not use paid sick leave or expanded FMLA to make it up because they're no longer scheduled to work. Even if the reduction in hours is related somehow to COVID-19 because of a closure order or whatever, or you know, your orders from other customers have been canceled or postponed and therefore you don't have work. This is not a situation where the employee was prevented from working those hours. Those hours, those worked hours, that schedule of worked hours has gone away. And so therefore they can't use the paid sick leave or the expanded FMLA to make that time up. However, if for some reason there's a question of whether or not the person has reduced hours because of a COVID qualifying reason, maybe they're making the decision that they don't need 40 hours a week to homeschool their kids, or maybe they have childcare for only part of the time or things like that. They could theoretically use it to make it up in that circumstance, because that's not the employer reducing their hours, it's them reducing their hours. There is, by the way, guidance, new guidance that suggests that you can use that kind of school-related or childcare-related leave intermittently. You know, lots of us are familiar with intermittent FMLA. But that is only available to employees if the employer agrees. This is one of those rare times where they've really given the discretion to the employer. And then, of course, there's a bunch of language in the guidance that suggests that the employer is supposed to work and exercise flexibility and try to work something out with their employee. For example, if their employee says, you know, I have somebody to watch my children or something, or I have alternative daycare, but I don't have it for all the time. I want to use that expanded leave on an intermittent basis as opposed to a chunk of time. The employers are instructed basically to try to work it out. But ultimately, the decision remains with you. I think we talked about this issue. What happens if an employee does not want to come into work out of concern for contracting COVID-19, even though they have no symptoms, that kind of thing? Then, as we talked about before, this is not an absence requiring emergency sick leave. Again, this is not an isolation or quarantine order. This is them saying, I'm not comfortable. The employer may decide to allow the employee access to other leaves. Do they have PTO, a vacation, sick leave, something like that, that you're going to just let them use it. You can also, of course, let them have unpaid, just a discretionary medical leave or discretionary personal leave, something like that. There's nothing that prevents you from doing that.
And
go ahead.
Oh, I was just gonna add into there, Laurie, that this is going to be one of those situations where other health conditions are going to be really important to analyze under the Americans with Disabilities Act and here in Wisconsin, the Fair Employment Act, in that, you know, as we've talked about, somebody having a general concern about contracting COVID-19 is not a reason for you having to pay the leave. However, if somebody has an underlying disability, particularly a mental illness or another physical condition where this fear of the disease is manifesting or exacerbating another condition, then you still have your underlying ADA and Fair Employment Act obligations that you need to walk through. You need to have your interactive process with that employee to see if this is truly related to the disability, and if so, what accommodations are available. So that's, you know, if somebody just says, I am so scared of this disease I can't leave the house, depending on what other background information you may have, you might have now enough info where you're perceiving somebody as disabled and have to have the interactive process.
That's right, because I think if you're going to talk about it in a little bit, Tony, COVID-19 is not, as a contagious disease, and presumably that hasn't erupted in something much more significant, is not a disability under state or federal law. It's like, just as the flu is not, it's not a disability, assuming that you don't have complicating factors that makes it turn into something else, like congestive heart failure or whatever it might be.
Right.
That might trigger a disability. However, yeah, like you said, if somebody's just generally scared, that's different from having underlying panic anxiety disorder or depression or any of those mental conditions that do trigger that. So you're right.
Right.
All right, let's go to the next. Okay. So Tony, I don't know if you want to start here.
Yeah, sure. So
these are some of the easy guys. Yeah.
Yep. So some questions that we've had about, well, what can I ask my employees about COVID-19? Because as we all know, there is an underlying trepidation always to talk about anything health related with your employees. You know, it's kind of one of those quote unquote off limits things, but here it's most certainly not. You can have conversations with your employees, and you can send your employees home based on certain things that manifest themselves. So one of the first questions was, can I send home an employee who has symptoms of COVID-19? Absolutely. As Laurie said, this isn't a disability that you have to accommodate. And quite frankly, you know, obviously we're in a public health situation. So you're going to want to decide what your policy is. And if your policy is somebody tests positive for a fever, yeah, it might not be COVID-19, but it might be. So we're going to send you home. You can absolutely do that. You can send them home, and you can create the underlying policies. So the next couple of slides go through that. And yeah, if somebody's been in close contact with someone, yes, you can send them home even if they are asymptomatic.
Yep.
The third slide down is a question that we've been getting quite a bit about taking the temperatures. Yes, you can require that as a pre-shift Did
I skip you? Sorry.
Oh, no, I'm here.
Okay.
I've got two screens going, everybody, so I might be looking at different.
Okay.
Okay, so
one of the questions that we've gotten from the chat is, what is an employer's recourse if an employee has ignored a request to self-quarantine due to contact with a suspected COVID case? That's the, you know, can an employer send somebody home involuntarily, whether they're symptomatic or not? And I think the answer is yes. Do you agree, Tony?
I do agree. I absolutely think the answer is yes. And, you know, there's enough going on where that's an entirely reasonable thing. And if that employee says, well, no, I'm not going to let you send me home, I'm not showing any symptoms, at that point, as an employer, you need to make the decision that is best for your company and the rest of your employees. And one stubborn employee who, you know, this isn't going to get me, that's not good enough. And if you insist on them going home, you know, hopefully it would never become where the employee is belligerent and refusing to leave. But quite frankly, if that happens, you need to take the steps you need to take to make sure that that employee is not coming to work. And you need to decide internally about how you want to handle that, as whether that was an insubordination event that could lead to discipline or termination. All right, so.
Sorry, you did that one already. That's the temperatures. We talked about that. Okay.
Yep, so next slide is about how much information can you ask for. I mean, you can ask employees if they're experiencing symptoms of the virus. There's nothing wrong with that. The issue just though is that you've got to keep that as confidential as any other health information that you get with regard to the employee. You know, do that in a safe and secure manner. Like if it's a call into the office, don't have that conversation right in front of all the other people who are in the office. Direct that to either HR department or another private office where you can talk about it. You can't share that specific information with any other employees, but otherwise in these times, no, you can absolutely ask that.
Mm-hmm. And then what happens? What are you telling folks if not as to the generalized workforce, because of course no employer is going to send out a company-wide email identifying the person who's been diagnosed. But what about the folks that person has worked in direct contact with? Can you tell the people who might have the desks right next to them that the specific individual, is that good practice? I mean, I think in reality, everybody's going to hit at that point. If you're only talking to a group in a small quad of, cubicles or something, people are going to figure it out. But what's your general advice to employers about what they can, if they want to give like heightened information to the people who that individual might have had direct contact? What do you think there?
Yeah, I think that's fine under these circumstances. It's a better safe than sorry type analysis. And yeah, let's say you've got an office pod of 4 people, and one of those people either is exposed or comes down sick. Without that person's permission, you clearly can't use their name. But I think you can absolutely state to your other employees that they were recently in close contact with somebody who's been infected, and they should take all reasonable steps, or that they're going to be asked to be quarantined. You're right, Laurie. Eventually, they're going to put the 4 puzzle pieces together to figure out who it was. But I think you owe that to your employees at this point, because you don't know what their home situation is. You don't know what their other situations where they could have somebody who's incredibly vulnerable in their house. And if it's to the point where you've got a desk pod of 4, and it's one of those 4 people, I'm comfortable with you saying somebody within your office space has been diagnosed. Because you don't want to leave it too loosey-goosey, because the employee might not take it as seriously as they would otherwise if they would have known, oh, well, I share a microwave.
It's just somebody in the end,
like that.
It's somebody, or it's just somebody within the business,
the UPS guy came in and he's got coronavirus. It is a lot different than the person that you were traveling in a car with. Yeah, exactly. So no, I think under these times, exactly right. And I can't imagine that after this is all over in circumstances like that any of the agencies would pursue any action about that. I think we all have to understand that these are unprecedented times, and that requires certain action. Yeah, exactly right.
Now somebody has asked the question, what if the employee works next to someone who is exposed to COVID by someone outside the organization? In other words, in your example, whether the secretarial quad or the somebody on a manufacturing line or something like that, they're working in close contact with someone who's been exposed but isn't maybe asymptomatic, or has just had, I think in that scenario, more information is better, right? I think that that you might not have to use names, but you can say that. And also, as to the person who's been exposed, maybe that person, for however the person has been visiting someone that has then been exposed, or has just traveled out of the country and was exposed and came back. Those kinds of things, I think you can and probably should take steps to remove that person from the workforce, at least temporarily, until the person is clear from a quarantine order.
I think you're right, Laurie. Yeah, I think, and if we watch the pattern of this disease throughout the country, I think that's the right advice. And maybe 3-4 weeks ago, it wouldn't have been the advice. But as we're seeing this grow and spread, I think we're to the point now where, if there was any potential to bring that into your business or your area or whatever, that more information is better than less.
And so this slide here, if an employee tests positive for COVID-19, or as we just talked about, I think you could expand that to someone who has been exposed in close contact with someone who has a known COVID-19 diagnosis. What are your next steps as an employer? I think it's really advisable to advise that employee to self-quarantine for 14 days. Ask the employee to identify, that's that trace mechanism that the CDC uses, to identify all coworkers that he or she came in contact with at least the 14 days prior, contact those employees in the ways that we've talked about, keeping confidentiality to the extent you can. Inform the entire workforce, at least those that were in contact, and meaning like in the same building. Inform the workforce that an employee has been diagnosed with COVID-19. Consider closing the office or the work site or whatever it might be for an OSHA-approved cleaning process if that's appropriate. And sometimes you can get guidance on that from the health department, the local health department, wherever you might be. And reassess risk to other employees and allow employees to work remotely if possible. Do you require, by the way, Tony, do you require a return to work note? You know, according to the CDC, they're saying in their guidance that a doctor's note should not be a prerequisite for returning to work. According to the CDC, and I'm just quoting from them, this is in part because this requirement would place a high burden on the healthcare system, and healthcare provider offices and medical facilities may not be able to provide documentation in a timely fashion. So that being said, that means that the CDC guidance, according to the CDC guidance, they're saying, you know, a person like who has been diagnosed or any of those or in contact and things like that should simply be permitted to come back to work only after they have, you know, they have fulfilled the quarantine period of time. And I think that that's probably makes a lot of sense given that situation. We don't want to be sending employees back to the doctor to get a return to work or, you know, order unless they can do that via some kind of electronic means like Tony mentioned.
Yeah, I agree. I mean, it's tough because, you know, we'll see how this plays out over the next couple of weeks. But if somebody's diagnosed for certain 2 weeks minimum, and the CDC is right in that we don't want to overly burden, but if it's something where, you know, we want to at least maybe ask the employee to show that they've reached out to their doctor to say, hey, it's been 2 weeks. I haven't had a fever for 7 days. Can I come back to work? And then I think you really just need to make a decision at that point based on the specific incident that you have going on.
Yeah, a couple of questions related to that is what happens if a person doesn't have a diagnosis, they're just, you know, exhibiting COVID-19 symptoms or saying they are, what do you tell them, other employees then? I think you're as transparent as you can be without breaching confidentiality. You say exactly that. The person doesn't have a diagnosis, but you should, you know, you should, while respecting confidentiality, tell people that they should monitor themselves and self-quarantine if that's appropriate. I mean, on the one hand, you don't want everybody, you know, creating a panic, but on the other hand, you don't want to minimize it so that people don't take it seriously. Well, this person may or may not have been exposed or things like that. I think you just have to be very careful there. There's another question, and actually it's a repeated question from lots of employees stated in a couple of different ways, but that is going back to what we talked about before with a furlough concept. If an employer, Tony, is not an essential business and they have effectively been shut down indefinitely, you don't know when it's going to start, and they are furloughed, is it best to, quote, fire the employees so they can collect unemployment or keep them on the payroll and hopefully get a loan to cover it at a later date? And I think that is just that the answer to that question is such a case by case and can't be answered with, because, you know, frankly, if you furloughed the employees, they would still get unemployment under this scenario in most states, and I can't imagine how they wouldn't. So I don't think firing them versus not firing them has much of an impact on, you know, their ability to get unemployment. And then beyond that, same thing with the furlough. If they are truly furloughed, they, you know, the obligation to provide paid leave is alleviated there. So I don't know that it makes any difference in that regard. Now, of course, which is way beyond the scope of this webinar, but will be covered in future ones, is when is it best to seek that SBA loan or payroll forgiveness loan things like that. And that is going to be such a case-by-case situation because, you know, it just depends on whether you're eligible as a business and things like that.
Yeah, I agree. I mean, there's no single answer to that. It depends on the status of your business, what you need to do, you know, your risk of basically placing your workforce out there into the free agent market, healthcare insurance costs and other costs like that. You really need to just sit down and analyze your own business in light of the options and make a decision from that.
Okay. Mr. Works. So this is going back to what the CDC at least has said with regard to when an employee can return to work after having COVID-19, or sometimes, granted, they're not going to have that firm diagnosis because maybe they didn't have a test available, but provides that a person with COVID-19 can stop home isolation when the employee has had no fever for 72 hours, 3 full days of no fever without the use of medicine, without the use of a fever reducer, and other symptoms have improved, and at least 7 days have passed since the employee's symptoms first appeared. Generally speaking, we've been talking about it in context of 14 days, and I think that is probably best situation, and that's the best advice, I think. Do you agree, Tony? Or are you giving different numbers? Yeah.
No.
Okay. 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 We talked about this a little bit before, that the ADA, does the ADA allow employers to require doctor's notes certifying the employee's fitness for duty? Yes, the ADA allows it. You're not going to get in trouble with a discrimination case or a violation of the ADA in terms of asking for information you're not allowed to ask for under the ADA. However, the CDC is suggesting that employees don't request it or don't require it, that only that you abide by the, as long as the employee has abided by the quarantine, then that's sufficient. Sorry, my computer is not going. Okay. I'm looking at some of the questions. We have a lot of them. No. This is one question from one employer. I have an employee who has been on some type of leave. I'm not sure what the acronym is. And now, because we have cut hours, is now angling to go on unemployment instead of working reduced hours. Any obligation in keeping them? Tony, I think that's really a good one, because that's the situation where you have available work for that person, and you as the employer, as far as I can tell from the various agencies here, are leaving the discretion to you as to whether or not you have available work, right? And
yep, that's exactly
the person, right. And as a lot of employees have figured out, that if they were to get unemployment based on their pay rate, they might actually make more money on unemployment than they would otherwise. And they're kind of angling, please furlough me, because if I do that, I'll get more than I would earning if I was working. And unfortunately, we have folks who figure that out pretty quickly. I think in that circumstance is that employee under those circumstances is really playing with fire, because you know, they might make themselves ineligible for unemployment if you as the employer are saying, I have available work, he or she just doesn't want to work those hours.
Right.
And
exactly.
you know, I think that that's the answer there. What if an employee is self-diagnosing they have, quote, symptoms? Can we require documentation to support? I think that's dangerous in this scenario if the employee is being told by their healthcare provider, please don't come in because we can't accommodate you. We've got, our schedules are full. I mean, that's unfortunately, hopefully you don't have employers or employees angling for something, but you know, it is what it is.
Yep. But I think that, Laurie, real quick, that category 3, I think, takes care of that, though, in that somebody can say that they have the symptoms, but they do have to be actively seeking medical treatment. Now, that doesn't mean that they have to have been in the doctor's office, but but I don't think that somebody says, well, I've got
And they don't have to have a diagnosis. Yeah.
Right.
Yeah.
You don't, but you at least have to be trying to talk to the doctor.
Yeah.
And that hopefully curbs the home doctors of saying, well, you know, I kind of have a sniffle, so I'm thinking I've got COVID-19. I need 2 weeks of sick pay.
Mm-hmm. Okay, let's see. Some people are asking about part-time work, essentially. Yes. The person is, we could ask our furloughed staff to work a few hours per week during the crisis and they could still collect unemployment. Yes, in most states, unemployment is permitted in situations where a person's hours have been reduced but not cut completely. That's, of course, a state-by-state situation. So you're going to have to check that. I know the person who had me asked that question is I believe, out of state. So that you'd have to check at the state level. Let's see. Are there any other issues that, Tony, that you're running into over and over?
No, nothing beyond kind of the general stuff that we've talked about today. You know, every business is different. And I think we've done a pretty good job of covering the major stuff. As for every, you know, your specific tweaks or, you know, one or two facts that are different, you know, just, you know, obviously it's recommended that you consult with your advisors and figure out your specific plan from there.
Sure. Sure. By the way, there's a question that's a little bit on point, but it's a thought that one little point that I wanted to make. The question is, if you had an employee and the company advised them to stay home, am I correct in understanding that we can't pay them the sick leave until after 4/1? Nothing prevents an employer from paying the person before the effective date. What you can't do is say, you know, I, as an employer, out of the kindness of my heart, we didn't, when this shutdown started or when this furlough started, we thought it was going to be a lot shorter. We, out of the kindness of our hearts, have given them paid leave, agreed just informally to pay them through now. If you have done that, you can't count it toward your obligation. Right. Well, you can't get another 2 weeks of paid leave because I already gave that to you. You can't do that. There is nothing, however, that prevents you from paying or not paying during that time. You know, you make that decision, but you don't get credit for doing it before the effective date of the law. I'm seeing that a little bit, like, well, I've done it. I don't have to do it again.
Do I get credit for this? Well, no.
Yeah.
Sorry.
Yes, you do. Okay. So those are the questions I think that have come at least through to my system so far. Our emails and phone numbers are on the screen. A lot of people, by the way, have asked the question, are the slides going to be available? The answer is yes. We have recorded this, this entire discussion, and we are going to provide the PowerPoint to everybody who has attended, and probably to others as well. So we thank everybody for participating today. You're going to get the slides. Certainly reach out to either one of us. If you send an email, I can reach out to you and give a cell phone number, and I'm sure Tony can as well. But that is, that's the most important thing. Certainly reach out and we can help you on your individual questions as well.
And thanks so much, everybody, for attending. And we're thinking of all of you, and this is unprecedented times and playing darts on a moving dartboard. But we hope that you found this was helpful. And if you do have any questions, you know, Laurie and I and our team are more than happy to help out you and your businesses.
All right. Thanks, everybody.
Thanks, everybody. Bye-bye. Have a good rest of your day. Bye-bye.
Bye-bye.